We often hear nurses called angels or heroes. We are praised for our compassion and our strength. People imagine us calmly navigating the chaos of the hospital. What they don't see are the hidden wounds. Many nurses carry invisible scars, the marks of post-traumatic stress disorder or PTSD. Behind our scrubs, a silent struggle rages. Nurses witness suffering every day. We care for patients in the most vulnerable moments of their lives. We see trauma, both physical and emotional. We make life or death decisions. These experiences, while inherent to the job, can leave lasting marks on our minds and souls. Many nurses suffer in silence. They fear judgment from colleagues or worry about jeopardizing their careers. But PTSD is not a sign of weakness. It is a natural human response to traumatic experiences. It is time to break the silence surrounding PTSD in nursing and provide support for those who need it most.
PTSD is a mental health condition that can develop after experiencing or witnessing a traumatic event. While often associated with soldiers returning from war, PTSD can affect anyone who has been exposed to trauma, including nurses. The nature of nursing exposes us to a wide range of potentially traumatic events. We witness death and dying regularly. We care for patients who have been in accidents, victims of violence, or are critically ill. We manage aggressive patients, deal with medical emergencies, and often face emotionally charged situations involving families. These experiences can stay with us long after our shifts end. We may find ourselves replaying events in our minds, experiencing nightmares, or feeling emotionally numb. The cumulative effect of witnessing trauma can lead to PTSD, leaving nurses feeling overwhelmed, anxious, and emotionally exhausted. Recognizing the signs of PTSD is the first step towards seeking help. It's important to remember that PTSD manifests differently in each individual. However, there are some common signs to watch out for in ourselves and our colleagues. Emotionally, nurses with PTSD may experience anxiety, fear, irritability, anger, or sadness. They may have intrusive thoughts or flashbacks of traumatic events. Some nurses may withdraw from social situations or isolate themselves from loved ones. Physically, PTSD can manifest as fatigue, insomnia, nightmares, difficulty concentrating, or an increased startle response. Changes in appetite or substance use can also be indicators of PTSD. It's important to remember that these symptoms can also be caused by other factors, such as stress or burnout. If you or a colleague are experiencing these symptoms, it's crucial to seek professional help for a proper diagnosis and treatment plan. Despite the prevalence of PTSD in the nursing profession, many nurses suffer in silence. There are several reasons why nurses may hesitate to seek help or disclose their struggles with PTSD. The stigma surrounding mental health is a significant barrier. Nurses are often expected to be strong, capable, and emotionally resilient. We may worry that admitting to PTSD will be perceived as weakness or make us appear incapable of doing our jobs. Fear of career repercussions is another concern. Nurses may worry that disclosing PTSD could lead to disciplinary action, loss of work opportunities, or even the revocation of their nursing license. This fear is often amplified by the lack of open dialogue and support for mental health issues within healthcare institutions. Additionally, nurses are often natural caregivers who prioritize the needs of their patients above their own well-being. We may downplay our own suffering or feel guilty about seeking help when we believe our patients need us more.
Behind the statistics and clinical definitions of PTSD are real nurses with real stories. These stories illustrate the profound impact PTSD can have on our lives and our ability to do the jobs we love. Take, for example, Sarah, a former emergency room nurse who developed PTSD after witnessing a horrific car accident involving a young family. The sights, sounds, and smells of that night haunted her for months. She experienced flashbacks, nightmares, and crippling anxiety. Despite her struggles, Sarah hesitated to seek help, fearing judgment from her colleagues and supervisors.
Then there's Michael, a pediatric intensive care nurse who developed PTSD after losing a patient he had grown close to. The emotional toll of caring for critically ill children, coupled with the grief and helplessness he felt after the child's death, became overwhelming. Michael withdrew from friends and family, isolating himself in his pain. These stories, though heartbreaking, are not uncommon. Countless nurses carry the invisible wounds of PTSD, their lives and careers forever changed by the experiences they have witnessed. By sharing these stories, we hope to raise awareness, break down stigma, and encourage nurses to seek the help they need and deserve.
There is hope for nurses struggling with PTSD. Recovery is possible with the right support and resources. The first step is acknowledging the problem and seeking professional help. Mental health professionals experienced in treating trauma can provide therapy tailored to the specific needs of nurses. Cognitive behavioral therapy, eye movement, desensitization and reprocessing, and medication are just a few of the evidence-based treatments available. Beyond individual therapy, support groups specifically for nurses with PTSD offer a safe and understanding space to share experiences, connect with others who understand, and find strength in community. Many hospitals and healthcare institutions also offer employee assistance programs that provide confidential counseling and support services to employees. These programs can be a valuable resource for nurses seeking help with PTSD and other mental health concerns.
PTSD is a serious issue within the nursing profession, but it does not have to define us. By breaking the silence, seeking help, and supporting one another, we can reclaim our well-being and continue to provide compassionate care to our patients. If you are a nurse struggling with PTSD, please know that you are not alone. Reaching out for help is a sign of strength, not weakness. There is no shame in seeking support, and there are resources available to guide you on your journey towards healing. Let's create a culture of support and understanding within nursing. A culture where it is safe to talk about mental health, seek help without fear of judgment, and support our colleagues who are struggling. Together, we can break the silence and create a healthier, more supportive future for all nurses.